Hi, thank you for your interest in Vermont RETAIN. I'm Karen Hike, the Medical Director for Vermont RETAIN, and this presentation is designed to give clinical practices information about participating in the Vermont RETAIN Early Return to Work program. RETAIN is funded by the U.S. Department of Labor, and I'm required to tell you that this presentation does not reflect the views of the U.S. government. In this presentation, I will talk to you about the RETAIN program, why work is important for health, describe the Phase 1 Vermont RETAIN program, and give you some case examples. And then I'll explain Phase 2 and what's involved in participating as a Phase 2 practice. RETAIN stands for Retaining Employment and Talent After Injury or Illness Network. RETAIN is a cooperative agreement between the U.S. Department of Labor, the Employment and Training Administration, and the Social Security Administration, as well as 8 U.S. states. RETAIN focuses on helping people who experience illness or injury remain in the labor force. One common misconception about RETAIN is that this program is only for patients with workers' compensation injuries. In fact, Vermont RETAIN is for anyone who lives or works in Vermont and has any type of injury or illness that affects their ability to work, regardless of their insurance. Although Vermont RETAIN works in collaboration with the Vermont Department of Labor's Workers' Compensation and Safety Division, it's not associated with workers' compensation carriers. This map shows the 8 Phase 1 RETAIN states. RETAIN projects are structured in 2 phases. So in Phase 1, we were tasked with standing up a state early return to work program to bridge the gap between healthcare and employment services using return to work care coordination. Phase 2 will be awarded to 5 of the 8 states to evaluate the programs they created in Phase 1. RETAIN took on more importance during the pandemic in Phase 1 to respond to the unemployment crisis, and we've integrated COVID return to work response into the program. We are approaching the end of Phase 1 and preparing to apply for Phase 2. Overarching both Phase 1 and Phase 2 is a continuous quality improvement approach. The 2 primary outcomes are increase in employment retention and reduction in long-term work disability. But we can also include any outcomes that are of interest to our project partners in the context of program quality improvement. The reason that RETAIN is important to Vermont is that Vermont has one of the highest Social Security disability rates in the United States. And we have the second highest rate of young people receiving Social Security disability insurance. The most common diagnosis among young people receiving Social Security disability are mental health disorders. And you can see in the graph that our rates of Social Security disability beneficiaries with mental health disorders are much higher than the national average. And the second most common reason for Social Security disability benefits in Vermont are musculoskeletal conditions. The reason we care about unemployment is that working is a health outcome. The longer someone is out of work, the less likely they are to return to work. You can see on this graph at 12 weeks, a worker has about a 50% chance of returning to work. And the chance of returning to work precipitously drops off after this, such that at 1 year of work disability, the likelihood of return to work is very low, much less than 15%. Oftentimes, patients come to attention after the return to work window has closed. So the idea of RETAIN is to capture people within the return to work window to help make sure that they don't become permanently disabled from work. One of the reasons we want to make sure people stay employed is because unemployment is an independent risk factor for adverse physical and mental health outcomes, not just for the unemployed person, but also for their spouse and children. Primary care providers deliver most of the early injury and illness care in Vermont, yet receive little to no training in return to work. And again, workers often get help very late in the process or aren't connected to employment services at all. So that was the rationale for the RETAIN program here in Vermont. And these were our pilot practices in phase 1. Practices used a universal 2-question patient self-screening survey that can be accessed through a link or QR code or completed on a paper form that identify patients at risk for work disability. The patient's answers are entered directly into the Vermont RETAIN database, and a RETAIN coordinator calls the patient back and explains the program, does the eligibility screening, and helps the patient enroll. So we don't ask providers to do any of the eligibility determination. This screener is completed by the patient, and we at RETAIN follow up directly with anyone who screens positive. So if you hold up your smartphone camera to this QR code, it will take you to the live screener for Community Health, one of our phase 1 pilot partners. And we can customize this screening process to meet the needs of your practice, your providers, your patients, and your workflow. Once patients enroll, we provide early stay-at-work, return-to-work care coordination that focuses on identifying the barriers to work and also helping patients achieve their health and work goals. Our coordinators offer support using a strength-based model to coach, empower, and teach lasting skills. We want patients to be able to advocate for themselves after their period of care coordination is over. Coordinators also help with communication with all the stakeholders in the stay-at-work, return-to-work process, such as employers, counselors, providers, specialists, rehabilitation providers, vocational counselors, etc. They also provide education and resources. We'll talk a little bit about that later, and help connect the patient to healthcare and employment services that will help them return to work. We also have a central team of stay-at-work, return-to-work experts that can help address work barriers that are beyond care coordination needs. Thus far in phase 1, we've received positive feedback from both patients and providers, and we have seen positive effect on patient work outcomes. One question we are often asked is whether RETAIN services replace care that patients are already receiving. Our services are designed to connect and amplify but not replace current care. These next few slides give some examples of the types of cases we have supported. We help people with work injuries navigate the system so that they receive coverage for their injury if appropriate and get appropriate work releases to facilitate return to work. We also are helping people who are at high risk for severe COVID infection find alternate safe work rather than apply for disability. We can also connect people with chronic medical conditions to job retraining opportunities and help with finding funding for job retraining. We see quite a few people with musculoskeletal injuries who need help getting off the couch and returning to activity. Another condition we can help with are head injuries and post-concussive syndrome. These cases can be challenging because cognitive deficits can interfere with ability to schedule and keep appointments. We can help patients establish with neurorehabilitation and maintain their treatment plan. We also offer trainings to providers in best practice for return to work. These next few slides show some pre and post survey questions from a RETAIN COVID Readiness to Work talk we did in the summer that show the need for education on recognizing patients at risk for work disability. And on the right, you can see the post-training survey response indicated that participants were more confident after the training in assessing patients at risk for work disability. Similarly, post-training participants were also more confident in knowing how to write a return to work letter. In addition to care coordination and training, we offer various types of information and resources. This is an example of some of our resources. This is a screening tool we developed to help providers assess for health job mismatches that could interfere with successful return to work during the pandemic. And along with this is an intervention tool to help address the health job mismatches once they're identified. Phase 2 of RETAIN is an implementation project, again, to test the effectiveness of the state early return to work care coordination we developed in Phase 1. So in Vermont, Phase 2 will be a cluster randomized trial by PCP practice. And there will be 2 groups of practices, some that receive stay at work, return to work best practice resources, and others that receive best practice resources plus care coordination. And patients will be eligible who have both work-related and non-work-related injuries and illnesses. Again, we're trying to capture the population of patients with mental health disorders that are interfering with return to work, as well as musculoskeletal and other types of injuries and illnesses. The follow-up surveys after enrollment will be done by Mathematica to evaluate the primary outcomes. So we're aiming to recruit 34 primary care practices in each arm, and our target enrollment is 30 patients enrolled per practice over the 2.5-year enrollment period. So this ends up being about 1 participant per practice per month enrolled. This will result in 1,040 participants per arm at the end of the enrollment period. This is the Phase 2 timeline. So if Vermont is funded in Phase 2, the administrative startup period will begin in April 2021 and last for 6 months. Enrollment will start in October of next year and last 30 months or 2.5 years, and followed by a 1-year follow-up period. At the end of the enrollment period, all comparison practices, so that's the practices that get resources but not care coordination, will get care coordination for their patients during the follow-up period. There are many opportunities for practices within Phase 2 RETAIN. We really have designed the program to be flexible and responsive to practices. Main opportunities for practices in Phase 2 include financial compensation to practices for the time you put in recruiting and enrolling patients, and financial compensation to both intervention and comparison patients for survey completion. Practices can either partner with Vermont RETAIN to deliver stay at work, return to work care coordination through our care coordinators, or we can provide training and financial support to care managers or care coordinators that are embedded in your practice. We have created Vermont RETAIN in partnership with our Phase 1 pilot medical providers and have designed it to minimize provider and practice burden and maximize support for patients and providers. The main components for participating in Phase 2 are first enrolling by providing some basic demographic information about your practice. We'll work with you to set up the screening process that works with the workflow for your clinic. We will also ask for participation in a 1-hour best practice stay at work, return to work training with free medical education credits and pre and post surveys that can help us improve the program. We suggest that you designate a RETAIN liaison from your practice to have brief monthly check-in meetings with your care coordinator or your study coordinator in your region. You'll receive best practice resources for both providers and patients in your clinic. And participating involves accepting randomization to be able to evaluate program effectiveness. Again, this is the resources versus resources and care coordination. And then you'll have the opportunity to advise on Phase 2 program measures that are important to your practice that we can incorporate into the quality improvement process. There are many potential benefits to participating in Vermont RETAIN. What we hear most often from providers is that they appreciate the support caring for a challenging patient population. Vermont RETAIN support can also help with chronic disease and behavioral health outcomes, improve chronic pain management, and reduce opioid use through focusing on functional recovery. We can also enhance connection with existing programs and services and broaden the scope of complex care coordination for your practice. Ultimately, we expect that RETAIN will reduce healthcare costs. So in summary, unemployment is an independent risk factor for worse physical and mental health outcomes for unemployed individuals and their families. Vermont has one of the highest work disability rates among young people in the United States, and this disproportionate burden of disability in Vermont negatively affects the health of our community. The impact that Vermont RETAIN will have on work disability can also support your providers and improve health outcomes for your patients. We hope you'll join us as a Phase 2 RETAIN partner. We love questions, and if you want more information, you can contact us at the number and my email address below. You can also visit our website at vtretain.weebly.com. Thank you, and we look forward to working with you.